Hello, I'm Mark Rickenbach, and I'm going to tell you about a story about continuity of care over the last couple of years. A story to be told of continuity of care. A story to be told of battles fought and won, of knights of the realm and champions just begun, of lives saved and the populace supported, all for a fundamental belief and truth that needs to be sorted. The name of the prize is continuity of care. There are several types, so be aware. Relational is doctor-patient contact, face-to-face or phone. There is information or management. Our use of words we must hone. Informational continuity is sharing of good notes. What went before to build on from, using handy quotes. And continuity of management is having the same boss to give consistent focus and direction, for without can be a loss. This 2-year Health Foundation program asked how to increase relational as its focus, looking at GPs, some say great person or just general practitioner, depending on your locus. But relational continuity does apply to us all in healthcare, including nurses and others, irrespective of any uniform we wear. This battle is for hearts and minds, as you may know. Continuity of care is crucial, a message we have to sow. The evidence is consistent and a significant amount. It includes reduced morbidity and mortality when statisticians do a count. GP urgent care and emergency admissions they do fall, as well as workload. For continuity means less duplicated tasks to see or call. And satisfaction too, it does increase for all. For patients, staff and doctors, bringing back that feeling of success that you GPs may just recall. So what is the catch? As it is all so clear-cut. Advantages outweigh the problems, yet people still shout, but. The concern is that change may make things worse. It's easier to sit tight, struggle on, and just moan and curse. And some say it might reduce patient access to GPs or to their time. This is a myth that knights must challenge to keep our facts in line. For Peer Health in Somerset and One Care near Bristol have both shown this is folklore. The opposite, increased access applied to their populations, which were deprived or poor. So take a risk and make a change, for the benefits are many. Problems can be overcome, so think on until it drops this golden penny. We have shown workload is down and access is up, which meets a measured goal, and surely argues for continuity to underpin healthcare as a whole. The biggest catch of relational continuity is that you see the same person over time. Hooray, we all cry. That seems so good and fine. But for some GPs, their heart does sink at the idea of the same person again and again. At least that is what they seem to think. But if you allow some time, listen carefully and ask about their past, the heart sink feeling lifts and you appreciate the story of how their path was cast. Your understanding and insight now re-energizes you to help them in their strife and help signpost them to resolve the complex many issues of their life. Is there a risk you might overlook something out of kilter if you are familiar with the person and have a higher factual filter? Or actually, are you more likely to notice something strange as you know the pattern and are able to pick up a much smaller change? If a patient sees the same GP 2 more appointments out of 10, then there are 6% less GP emergency admissions for children, women, or men. Core culture and belief in continuity is key, as Joe at Morecambe Bay cries out. Achieve this by involving all, patient, GP, and staff. We all shout. There is the St Leonard's Exeter concept of full personalised care as one type of relational continuity to pursue and share, where every key thing passes back to their one named GP to do or oversee. All blood results, queries, drug changes, and letters too. Some mistakenly perceive this as old hat and a relic from the past, but it does work well for both part-timer or the full, and the impact can really last. So if this seems too much, consider it as a spectrum of continuity and relational care. You can get on steps 1 to 6 of our new toolkit path at low or high or anywhere. This GP toolkit is a guide with simple steps to take, which another night our Joe with Julia describe as a recipe of cake to bake, jam-packed with resources, tools, information, tales, and fact, to measure continuity and fit with the motto, plan, do, study, act. A little change, however small, can help. All our 5 sites, they do say. A little nudge within the team, a small move that gets you on your way. You might select just one group or more for your first attempt. Frequent attenders, diabetes care, learning difficulty, or frailty you could preempt. Valentine Health in London and OneCare, Bristol Way, have done just that. They looked at the needs of people who often, in their GP's chair, had sat. They saw the danger that was lurking there of being in many a different GP's chair, of duplication, repeated stories, later diagnosis, and emergencies. So all be aware. For the Health Foundation programme, across 500,000 patients and 5 UK sites, has shown us how to do it in big or smaller bites. Continuity can be achieved for all, and everyone can do their bit, is the message we must loudly call. And thank you to the 5 Health Foundation programme sites: Morecambe Bay Primary Care Collaborative in South Cumbria, Valentine Healthcare Partnership in London, OneCare in Bristol, Peer Health in North Somerset, and St Leonard's in Exeter. Too many to name every person, but thank you all. And do go to the Continuity of Care Toolkit at the Royal College of GPs website. The Royal College of GPs is the learning partner for this Health Foundation programme. I hope you enjoy the toolkit, find it useful, and do that little change in your own practices. Thank you.